The following events were recorded as they happened at the Hospital for Sick Children in Toronto. In this episode of Life's Little Miracles, Samuel's kidney transplant and Stephanie's knee surgery. Three-year-old Samuel Mazza and his parents have traveled to Toronto from their home in Saskatoon. Samuel has chronic kidney failure and needs a transplant to survive. His father, Francis, will undergo surgery to donate a kidney to his son.
She's kind of nervous of that look of yours.
You okay?
Your daddy's giving you a very special present. You're gonna get your daddy's kidney.
Now the transplant is in jeopardy. After removing Francis' kidney, doctors have difficulty flushing the arteries of blood.
Vasopressors. I need his pressure up. His kidney feels too soft. When we take the kidney out, we have to clear all the blood completely. Otherwise, the blood forms little clots inside the kidney.
How's that now? How's the flow now?
None.
Okay, have I got any flow now?
No. Hang on. There you go. Now you've got it.
Okay, because that's going right in the artery now.
Good.
It is getting clear. It has now cleared that upper pole.
Coming through. 1, 2, hypos, 1, 2.
All done. What Dad is just waking up now. I had to make his incision a little bit longer than I normally do just because he's a big guy. It was very hard.
It was. So is he going to be, I mean, he'll still be same amount of pain or whatever, like it's not going to affect that.
Maybe a bit more sore than our normal guys. And Dr. McClory is now just beginning to sew it in on Samuel and opened up the vessels that he's going to be suturing to.
Yeah.
And he's starting to do the sewing as we speak now.
Last year, 8-year-old Stephanie Onandraj had surgery to repair a malformation in the cartilage of her left knee joint. Now, her right knee has developed so much pain that sometimes she's unable to be active. Today, Stephanie will have a second surgery.
So tell me about these knees of yours. When did they start to hurt?
When I went last year in winter.
So you used to have sore both knees, and then we fixed one, and now the other one's acting up. Oh, okay. And what makes it worse?
Skipping and rollerblading.
So it's slowing down your fun, is it?
Yeah.
Okay. We'll start with simple stuff. This goes around your arm and feels your big muscles. Do you have big muscles?
No. Daddy has big muscles.
Oh, Daddy has big muscles.
But I can beat Daddy.
Oh, yeah? What do you beat Daddy at?
Wrestling.
No way. Great.
She's become a veteran.
I want to be a professional doctor.
A professional doctor, not just a recreational one. That's good. Good for you, kiddo. Go for it.
Thank you.
Bye-bye.
Bye-bye.
Bothering you?
Come on. Over here. It's going to be okay. Is your knee still bothering you? Yes. In some people, when you move your knee back and forth, it will catch the meniscus inside between the two bones and pinch it. And so that pinching hurts. And some people get symptoms from it. We can take the middle part of the meniscus, which is a torn part, and we remove it and just leave a normal rim around the outside.
She cannot do strenuous thing like tap dancing or,
Yeah.
you know?
She should be able to, once it's all healed, she can do whatever she wants.
Yeah?
Yeah, as long as it's legal. And and Mom and Dad says, okay, you can do whatever you want to. There's no operations that are completely without potential risks and complications, but it's possible we might need to make a bigger incision to take the little piece of cartilage out. Okay.
In big kidneys in little children, I find what influences me most is just the lack of space. Okay, ease the kidney down. Slow down a bit. Take up the slack on the other strings, please, Joe. As I'm going down. Ease it down. It's stuck. Use an instrument if you could, Alan. Just I can't see. There's the kidney pinking up. So we're not making a lot of urine. That I think we can tell.
It may have a bit of ATN, and hopefully that will resolve on its own. We'll see what the ultrasound shows.
Well, I'll go and have a chat with the mother.
He's shivering from the anesthetic, and we're trying to get him warmed up. You're sore? Are you sore in it? You're still cold. Okay.
Hi there. How are you? Dr. McClary. We're opening to the little boy. Okay. And everything is going as well as we could want. With respect to the kidney, he's not putting in a lot of urine right now. He did originally.
Yeah. So why wouldn't his kidney be producing lots of urine?
It just takes time sometimes to adapt to the one change to the other. Okay?
Thank you.
So you've got two loved ones here.
Yes.
And they're both doing as well as we thought.
Great.
Okay?
Yes. Thank you.
I'll talk to you later.
For kids, it's quite scary, you know. Even for adults, it's quite scary.
We're ready to go in. So, do you want to walk with me to the door? Okay. So, we're going to say goodbye here. So, if you want to give Stephanie a big hug. Go goodbye.
That's good. A strong good, right?
Stephanie, I just have a little clip that goes in your finger.
Yeah, I'm just going to start giving you some medication, okay?
Just take some nice deep breaths for us.
Do you want to hold the mask?
It's actually up to the ICU. He's on some morphine right now, so when he wakes up, he should be.
Mommy's here, Samuel. It's okay. Mommy's here. Mommy's here.
They'll be checking his urine. Like tonight, they're probably going to be checking it every 15 minutes to half an hour.
Or you just bring off some, yeah, actually, yeah.
Let me just take these off.
Why?
You don't need them now. Where's the other one? Where's you got one more down there? Yeah. Let me get up. All right, let me get up now.
Mommy.
Okay, it's okay. Just to the new bed. Just to the new bed. Okay?
Mommy,
One.
Yeah, I'm coming.
Okay.
Mommy,
One, two, three.
There.
Hey, there.
So we're putting all this fluid inside the knee joint itself. So I'll put it inside and we can see what we can see. Okay, so now you can let the fluid in. Okay, now, here's our meniscus. See the stuff over there? The tip of that probe is pointing at the femur. The bottom part of the probe is pointing at the tibia. So we're going to need to remove some of the inflammatory tissues around the outside of it And then we're going to take out the middle part of that meniscus and shape it down to make it look like a normal meniscus like the one on the other side.
No, at least for the rest of her life, she doesn't have to go through that pain again. At least she can live a normal life, not worried about pain or anything like that.
Nice to see you. Daddy.
Samuel,
Dad.
how are you, buddy?
You put on my tummy. Yeah.
Did they clean you up? Huh? Did they wash you?
Oh, he's just sweating. Not feeling good, hey? You don't feel good either? You can show Daddy how you can blow
You
bubbles.
can blow bubbles now.
That lady brought you some
Let
bubbles.
me see how you do it.
You miss Daddy?
I miss Samuel too. Miss you, Samuel. Maybe later.
You can hold his hand.
Maybe later, come back.
Why don't you hold his hand? There, you can hold hands. There.
Oh, Daddy.
You see like the little piece flapping right in the middle? It's like having a tire with a little flap on the end of it on your bicycle or your car, and every time it flops around it bangs and makes noise. Or there you go. Okay. So, perfect. And there it is. It's nice, like a normal looking meniscus, well attached.
Hi. You're doing great. Very great.
Everything went absolutely perfect, just like on the other side. The loose piece was moving back and forth in the knee. We took out the area where the tear is and shaved it back down to make a normal rim around the outside, just like we did on the other knee. And she should do very well.
Okay. Thank you.
Okay.
Thank you
Do you have any other questions?
No, that's
okay.
Thank you very much, Doctor.
Okay, so, they're going to take her to the recovery area, and then, once she's feeling comfortable, she'll be able to go home today. Okay?
He's complaining about some pain in the tummy, right? Is there any fever or anything else going on today? Okay. No fever, right? Let's do the test.
That's Daddy's kidney.
Samuel's kidney now.
It's yours now.
Yeah, it's yours now. I think you get to keep it.
You're not afraid anymore.
Okay, I move down.
This is Samuel Mazda's belly, and there's a sliver of air up here. If that persists and stays there, then that could be more worrisome that something is going on in his bowel.
Right away. Do you want to tell me what drug you do? Sure, it's
easier.
Just got quiet over there.
Feeling tired?
Go anywhere.
Sleepy?
No pain? No. Started. She's fine now.
Karate. Hey, don't shake too much.
Relax.
At home, okay? Karate.
Hi guys. So, but he does have this abdominal pain. He's growing this bug, you know?
So you think that's what's causing his
I do.
abdominal pain, okay?
You know?
Okay.
See you, Sam. You got an eyeball. Oh, there you go. Look, Samuel, look.
Oh,
I can see you with my scary eye.
Come on. Yeah.
Yeah, I just want to see if these are tall enough for you. Since you grew, eh? Well, they might be too tall. Is that too tall?
Yeah.
Yeah.
Let me.
Where were they before, down here?
Now we'll have to do trial and error.
Yeah, to see how tall she is.
Yeah, this is better.
That's a good height?
Perfect.
Yeah.
No, just until here and come back. Just in that diamond over here and come back.
3 hours after her surgery, she's trying to walk. It's not bad. Good girl. Good girl. So you cannot be going out and playing and all, right? Once it heals, then you can play, okay?
Hey, Samuel. This is the first time I've seen you since you donated the kidney, and you look very good.
I'm doing okay.
It's a big operation, as you've found out, and it's painful.
Yes.
But you look like you did before. I think you've lost a little bit of weight. Do you think he's lost some weight?
I think so.
Okay.
Thanks.
Well, there have to be some benefits for this. And the biggest benefit, you look at your son, and he looks great.
Yeah, he's doing very well.
Yeah. This is his 8th day, and as far as we're concerned, he's done very nicely in his response to his immunosuppression drugs. So he's got the kidney functions very well. All in all, I think he's marching through all this very well.
There you go.
There you go.
Look at you. Pretty soon you'll be eating sandwiches. Oh my goodness.
Slow down.
How are you doing?
Fine.
Fine. How's your knee doing?
Okay.
Okay, can I take a look at it?
Sometimes she cracks her knee and is howling in pain.
Really? How do you crack your knee?
I just stretch it, and then when I just bend it, sometimes it just comes.
Okay, maybe what she does is she can make her kneecap come in and out of joint a little bit, which may make her uncomfortable. It's possible. That's what's doing it. And, I'll write your prescription for a physiotherapist. Okay? That sound okay to you?
Yeah.
Okay.
And now she can almost do anything and everything she wants,
Yeah,
right?
she can do whatever she wants to.
I can even rollerblade.
I make sure she's padded with elbow pads, a wrist pad, a
helmet.
knee pad, helmet.
Yeah, don't forget all that stuff.
Everything has to be there.
Okay.
If I catch her without any one of them, she's grounded.
Okay, it could be doctor's rules too.
You want to be free, isn't it?
Yeah.
9 weeks after surgery, Stephanie's knee has fully healed. By having the cartilage in her knee repaired, she is no longer experiencing pain and is able to resume her active life.
She wants to try everything. I wish I could try the whole world. Daddy! Daddy! Go away!
Boys, look it. You got a present.
I got Annie.
We got Annie.
Oh.
Look at this.
Oh, here we go. Hello, is that your mommy? Is that your brother? It sounds like he had a really nice weekend. From what I hear, no more pain. So we're happy with his tummy. I mean, his tummy's nice and soft, he's eating, he's not vomiting, no more diarrhea, so I think things are looking really good.
Okay.
Yeah, we'll see you daily for blood work. And I mean, fantastic, right? Will you say goodbye to me?
Goodbye, Mina.
Goodbye. Okay, good luck.
Are you ready now?
Yeah, I'm ready.
Okay, let's do it.
2 weeks after his kidney transplant, Samuel can be discharged.
Going home, finally.
His family will live in an apartment in Toronto for 2 more months to be close to the hospital's transplant unit. Samuel will be monitored throughout his lifetime, but doctors are confident that his transplant has been a success and that Samuel will continue to thrive. The following events were recorded as they happened at the Hospital for Sick Children in Toronto. On this episode of Life's Little Miracles, Callah's struggle with cancer and Kieran's shunt surgery. "15-month-old Callah Dumichel has cancer tumors on both her kidneys. She is being treated for the cancer with chemotherapy. Today, Callah's mother has brought her from their home near Sudbury for a CT scan to determine if the chemotherapy is working. If not, Callah will need immediate surgery.
Nice to see you again. How was Sudbury?
It was nice to go home.
Everything went well?
Yeah.
All the chemo?
Yeah.
Everything went
Yeah.
well? As you know well, there was one larger tumor on the right kidney and then some smaller lesions anyway found on both the right and the left kidney. We are doing the CT now to see what the effect of the 6 weeks of chemotherapy was on all of these lesions and to decide whether she's ready for surgery or not now. There's a very small chance that there may not have been a response to the chemotherapy, and if we see any growth, then we would do the surgery now. We wouldn't wait for a few weeks.
Right away?
Mm-hmm. Yeah. But I don't expect that they do that.
I don't know what to expect.
Yeah.
Bilateral was rare enough to have that.
Why don't you have a quick look at her, so, and then we can do all the paperwork and the chemo orders and things like that. Excuse me, madam.
It's okay.
There you go. Okay. Well, everything sounds fine. Hopefully the CT will show a response today. The chance for cure and eventual survival is good.
Yeah. 13-year-old Kieran Hale was born with spina bifida, which usually results in paralysis. Mysteriously, the only condition he developed was hydrocephalus, a life-threatening buildup of fluid on the brain.
That is the spot.
Since birth, a shunt has worked to release the fluid into his abdomen. Now the shunt is malfunctioning. Doctors must operate before Kieran suffers permanent damage.
All right, let's go.
Hi Kieran, I'm Mary. I'm going to do your CAT scan today, okay? Have you had one of these before?
Yep.
So you know it's just pictures. The machine is quite large, but it's just pictures, okay? All right. Now lie on your back. All right. You're going to put your head in this little holder.
You okay so far? All right. Okay, here we go.
You know, you could almost say he doesn't have spina bifida. Well, he does because it's been seen at birth. Now, his problem is that in this segment of the catheter coming down behind his head, we have fluid gathering underneath the skin. We're convinced that it's spinal fluid, and secondly, it has got to be coming from somewhere, in my view, inside this tubing, and it's leaking out because of a small hole or whatever. Let's face it that as we come to this point before his surgery, we still don't have an answer as to why this fluid's gathering there.
That's the shunt right there. You okay? Yep. All right.
No, it's fine. Aren't you?
I'm still nervous though.
Oh, I know.
Oh, I know.
Do you want to sit on the chair by yourself? What you want? Good girl.
So here's Call's contrast.
So this just like makes her insides glow, or?
Well, it makes it sort of look like it glows on the pictures.
Oh,
Okay? Be right back.
Drinking. A little more.
Catch your breath. Okay, Mel, we're just going to ask you a few questions. We know about the problem with her kidney.
She has 2 tumors on one and 4 tumors on the other.
The medication that we're going to give her is called Nembutal. We give the smallest dose that we can give to put her to sleep so we don't oversedate her. So what we'll do is you can hold her in your arms while I give it to her. When she falls asleep, we'll put her on the scanner. And when we're done, we'll be taking her to the recovery area. If this is really bothering her, I'll take it off for now.
Well, it's got to go back on her.
Yes.
Everything bothers Calla when it's touching her.
You've been through this a lot too, so you know the process as well, right?
Yeah, we've only had CT once, but it was just, like I was there, but I wasn't, because we just found out what was going on, and it was just so overwhelming at the time.
Okay, so I'm just going to speak to the doctors and let them know that we're about to be ready to start. No, it's fine. Okay. And this is her Nembutal.
That's the stuff that puts her to sleep.
Yes. And it works rather quickly. She's just trying to stay awake, Mom. That's what she's trying to do. There we go, sweets. Raise your arms up. Mom, I'll be standing right here by the door, and I'll be monitoring her with this oximetry and a blood pressure tablet. Okay? Yeah, you can do it there.
Okay, go. She's telling you, or would you prefer it in 7?
We will change the way the images look and reformat them in different projections to get a better view of what's actually happening within the kidneys.
Okay. So what are they gonna do? Like,
He's gonna open the back area here, check and find out where it's not working properly, and fix it.
are they gonna shave my head?
They may have to a little bit, but just over the site of your shunt. They won't know until they go in exactly if they're going to put a new shunt in or what they're going to be doing. It depends what he has to fix when he goes in. Okay? All right, let's go.
Oh, this is good. You're not getting needle down to it or anything. You know, you're going your own steam.
All right, so you see Dr. Humphrey shortly. Okay? Mm-hmm. All right, we'll see you later.
Okay.
Bye-bye.
We'll go back to being normal soon, don't worry.
Hey, big smile. You do right.
Here comes somebody.
Morning.
Good morning.
You having a cool summer? You know what we're doing? Yeah. That drainage tube that was put in has served very well. But when we see this region of swelling right in here, adjacent to the wound, That's usually the indicator that something has fractured or got a hole in it, and it's gathering in this classic location.
He has been kind of a puzzle since day one because he hasn't shown any of the symptoms that he should show.
This is a good kind of a puzzle.
Yeah, sure is.
Absolutely. Okay, you folks can go around. I'll come and meet you afterwards and have a little chat.
Too much fuss. Fuss.
The radiologist has to compare with the last scan. Can't really tell anything from one.
So she's doing fine now. We're nearly finished. Okay, thank you.
That's it?
All finished.
Great, all done.
The nurses in here will just do a set of vital signs, and then they'll be calling you in to see her.
Because I want to be there when she wakes up, tell them that.
Okay, I'll let them know. All right?
One to the left. And this is from CT. She's probably not on that sheet. They were just going to call there.
And Kyla's how old?
She's 15 and a half months.
It's okay. Hi, my name is Linda. I'm going to be one of the nurses in the room with them. Okay? So you ready? Sure. And I'll come and see you later. Okay, why don't you give Mama a hug? Come on, it's gonna be over in an hour. All right? Kieran, all right? All right.
So can you see the original scalp wound? Right there, excellent.
See how clear it is underneath? Just about attenuated.
Yeah. Well, what have we got here? Look at the fluid coming out right around the catheter. So it's issuing out around the outside of the ventricular catheter, which I told the folks would not likely be the explanation here simply because it's been in place for almost 13 years.
She's not awake yet, Mom? Yeah. Yeah. Maybe it's better anyway that she's asleep.
Did we not do this the last time?
Yeah,
I think
we did.
so.
Did they say if Dr. Wiseman's going to give me the results of the scans today? Or is she going to call me with them?
They usually don't give you the results right away. We can page Dr. Weitzman.
I was just curious of whether the chemo's working and they've stayed the same or they're shrunken, like they've shrunk at all.
So, contrary to all our expectations, the catheter tip is stuck in the brain, and we had every possibility considered, but this was the bottom of the list. And that stuff's plugged up there. You know, it's amazing you didn't have any kind of headache or anything like that.
Any symptoms whatsoever, really?
Yeah.
Okay. Yeah. Can I have a silk, please?
Okay. Beautiful. Don't go to the horse races with me and put your money on the odds because the least likely to win was the cause. The catheter was plugged in the brain and stuck. There was no fracture, there was no disconnection, there was no hole. So we have put on a new year 2000 reservoir valve, and I counted at least 3 times when Dr. Creighton and Isida said, why has he not had more obvious symptoms? You know, like headache and vomiting, the sorts of things that we talked about before. It beats me. So that's that. And we'll see him back in clinic in September, October. Okay?
Great, thank you very much.
I thought I was going to be able to bring a piece of tubing out with a hole in it, but...
So we struggled for years now trying to figure out what it was, and the doctors didn't know. Now we've got an answer. Right? Now we know exactly what the problem was. We making them? Hey, way to go.
Steve was really scary.
Was it, love? Didn't like it at all, eh? Nice sweet rest.
Just relax. Hey, you did good. You did real good.
They just contacted us yesterday late afternoon and said to be here for 11. Okay, just sign right here for me.
Kayla. It's Calla.
Calla.
Like as in the lily?
I'm tired, baby girl. I'm tired. I'm tired.
Oh, it's spoiling me now.
Hi.
Dr. Corey, how are you?
Hi, I'm Shelley.
Hello.
My husband, Mark.
How are you? Have you had a chance to go over her CT with Dr. Weitzman? Let's see what would be.
She just gave me a phone call with the basics, but I didn't get to ask too much. Okay. Because she was quite, I think, shocked at the findings.
Right. The right kidney, I must say, is a little bit worse off than the left. The right kidney has several lesions in there that would make it difficult to preserve.
You might remove one of the kidneys then, the whole kidney?
Well, our attitude is you go in trying to preserve as much as you can.
And she should do well with some of her, with most of the left kidney.
A third of a kidney is plenty.
How successful is this? My reading isn't good.
There's always the risk of significant bleeding that may force us to go ahead and remove the kidney to save her rather than, have a kid.
She'd be on dialysis.
And then she'd have to go on dialysis.
Everything she's had in her whole life has been so rare, and if they say there's a small margin, she just seems to keep falling in it. And
Hey. It's a tough situation to be in, but we just have to be optimistic. We can't sort of say, this is too hard and it's not going to work out. You got to believe in miracles. Miracles happen.
I know we got to hit.
We'll do the best we can, and she's a little fighter. She'll pull through.
Oh yeah, she's got the attitude.
Is everybody in the sleep mode at 11:15? Holy smokes. How are you doing?
When I just stand up, I feel a little lightheaded and then it goes away.
Exactly. You've been smoking along for some time with the pressure inside the head a little up. And now it's come down because of the surgery yesterday. And hence you may feel a little dizzy when you stand up. Patrick, how does it look?
Just a little bit of paint there, the antiseptic solution we used. A little bit here.
Ow. It's just stuck here.
That's wrong.
That's all. Baby, it was stuck to the hair.
Now, what is the morning after question you got for me? When can I go home, right? Or have you even thought about it?
No. He's still getting over the shock of that bandage coming off.
I suspect you'll be hanging out until tomorrow morning. Okay?
That hurt.
It looks so good, Kieran. It just looks like the other side of your head now. No big lump anymore.
Oh.
It's fine.
Yeah. Tickle again. Arms up. Well. Yeah.
I think we're all set. Do you have any last-minute questions?
If something happens, you can't save the last kidney, you'll come talk to, let us know.
I'll let you know what's going on.
So they're taking her now, or?
Yeah, I'll have the nurses come by. And anesthesia's checked her already?
Yeah.
Great. Okay.
Okay.
Thanks. The sooner the better.
Come here, sweetie. I love you.
Okay, you gotta go on and just lay here.
Come on,
sweetie. Mom's singing a little bit. Hello. Oh, it's okay. It's okay. Okay, we'll see you in a while. Oh, thanks, Linda.
Somebody call into the waiting room, please, and just let Mom know that we're ready to start. She went to sleep okay, no problem. Okay, we're in business.
We're on the way. Everything went very well, and she's nice and stable and comfortable. Okay, so it's going to take about 4 hours, and I've instructed the nurses to come out and speak to you every hour.
10 minutes? No.
They're going to come out every hour and speak to you. So your next report should be about 4:45.
Okay. And I have one thing to sign to say he's going home with you. All right. Okay, so good luck.
Thank you so much.
Okay. So you can smile now you're going home, right?
4 months after the surgery to repair his shunt, Kieran continues to thrive. And his excellent health, in spite of the spina bifida he was born with, continues to be a wonderful mystery to Kieran's doctors and family.
That's the right kidney, and that's the tumor in the upper pole showing its face right here. Gently now. And then there's the big tumor that sits on top of that kidney, that occupies most of the kidney, and that's the one that grew quickly in size recently. There's more tumor back here, right there, and there. Now I think that kidney has to go. You agree, guys?
Yes.
Voilà.
Yeah, I think that's what it shows.
Let's go ahead and take that out. Let's keep on moving, guys. Boy, that's not a good-looking kidney.
Yeah.
Let's go explore the other kidney. And good luck to her, I hope. We find something we can save. Coolie forceps, please.
Doctors hope to save enough of Kala's remaining kidney to preserve its function. They will do whatever is necessary to remove all of the tumors and save Kala's life. The following events were recorded as they happened at the Hospital for Sick Children in Toronto. In this episode of Life's Little Miracles, Kyle undergoes surgery, and Kala's struggle with cancer continues. 15-month-old Kala Dumichel has cancer tumors on both her kidneys. She was being treated with chemotherapy when doctors decided to try to remove the tumors surgically.
Everything she's had in her whole life has been so rare, and if they say there's a small margin, she just seems to keep falling in it.
You gotta believe in miracles. Miracles happen. The last thing you want to do is give up.
Oh,
So,
I know that I hate that.
we'll do the best we can, and she's a little fighter, she'll pull through.
Okay, we're in business. Let's go. And then there's the big tumor, occupies most of the kidney. Now I think that kidney has to go. Let's go ahead and take that out.
Surgeons have had to remove the entire right kidney, but hope to save most of the remaining kidney.
Keep your fingers crossed. The area in the back part of the kidney that looked abnormal on the MRI, and it doesn't feel abnormal, Is it possible to get ultrasound to come and give us a hand here? What I'd like you to do is try and define for us the borders of that area in the front wall that represents the tumor.
There's the tumor
there.
Yeah.
Anything below that is clear? Well, that's good news for her. So if we go 2.5 by 2.5, we should have a good safety margin all around.
Absolutely.
I hope we can save most of that kidney.
Six-year-old Kyle has traveled with his mother to Toronto from Quebec, where his family lives on a dairy farm.
A little chilly, eh?
He was born with a malformation on his lip and cheek.
You need to go up one more.
Today, Kyle will have a procedure to block the blood supply to his lip. He will then undergo surgery to correct the malformation.
Did you have anything to eat or drink this morning?
No, I didn't eat anything. I didn't
Good
drink
boy.
anything.
Okay, so we'll give you a drink through your vein when you get in there. Give me a big breath. Come on. I see that smile. Okay, I'm just going to listen to you breathe. Good fella. Do you have brothers and sisters?
Only brother.
Does your mom not have any girls?
No.
No. All the boys.
Hi, Kyle. Can you come over here for a second, Kyle? Let's just have a quick look. Come over this way. Good.
Cooperation, remember?
Same size as before, right? Okay.
I thought
You can
it'd
go
be
play now.
same.
What could or what would happen to him if nothing was done, if he was just left to live his life with his lip malformed like this?
I'm not sure if Kyle is self-conscious about it now, but he probably will become self-conscious about it as he grows older.
And that's just what I was thinking of. Like I have 2 teenagers at home now. The girls are getting very popular at my house now. I see what my older sons are having, and I didn't want Kyle to miss out on that. That's such an important part of life, like that first kiss and everything else.
These are some of the films from the last angiogram I did. As you can see, the blood supply is quite rich, or quite intense.
Yeah.
And what I want to do is to take away that blood supply. It's a pre-surgical treatment to decrease the blood supply to the malformation so that the surgical reduction of the lip can be much more easy. I expect that the cosmetic improvement will be quite significant.
Okay.
Okay?
Yeah.
Any other questions that you thought of?
No.
This is our room.
He's been in the sleepyhead room before.
You've been in our room before.
Where can I put my...
It's great.
Yeah.
And you have to go out the door. That's great. Marlene's going to show you out. Good care.
Okay, thanks.
Okay,
That was
great.
really great.
Do you want the spot on you or the rest of
I don't mind.
the
It's
spot on me?
yeah, the spot is good where it is.
You're all there?
Okay, this is the left external carotid. You go lateral, please.
Okay, I need to send this up to pathology, please. I need them to look at the margins. So we're in good shape with this girl, I hope. As long as her kidney doesn't form more tumors on us, we should be in great shape. All right, I'll go talk to them.
To the ICU.
Well, we're all done. Things went well. They're just waking her up now, and she's breathing on her own, so things went really well. The right kidney didn't look like we could remove enough tumor and leave enough kidney functioning tissue that would make it worth her while. So we ended up removing the right kidney completely. And then we went over to the left side. We defined together what part of the kidney needs to come out, and then removed that front wall of the kidney.
Her kidney that she does has, it's the same size as it was before. It's just
Missing the front.
the front part of it.
Right.
Okay. And it should function normally, you're hoping, and
It should. There's a chance that it will leak some urine where that raw surface is. But otherwise it should, yeah. She should have good function from that remaining part.
so now she'll be able to finish her chemo treatment and
Well, I'd like to wait a few days. I mean, we're not going to jump in. We'd like to give her a chance to heal a bit. It'd be hard to start chemotherapy if the kidney's not functioning well. And then we'll take it, you know, as it comes after that.
Yeah, it's been a day by day.
Yeah.
road
All right.
with Cal. Thank you so much.
We'll be fine.
Thank you.
Okay, guys. Take care.
Thanks.
It's good, Emma.
It's still not over. We fought this now. We can fight the cancer. Has she woke up at all, or is she still?
Yeah, she's cried a little bit.
Oh, has she?
Mm-hmm. She hasn't opened her eyes though.
No. Oh, sweetie, mommy's here. I just want to see what they did to her. Let's see there. So it goes across here. She's a drain here. And a catheter.
Carla.
Oh, baby Kieran. So strong.
Hey, you gonna wake up for Daddy? Hey?
Kyle's mommy, do you want to come in?
Yes, yes, I do.
Okay. We called for mommy.
Kyle. Hi, Mom's here. Can you hear me? Want to have a little sleep? Okay, I let you sleep, okay? Okay.
So how are you guys doing?
Hi, Dr. Phillips. How are you?
Yeah, I talked to Dr. Armstrong, and he was very happy that he was able to knock off the main arterial blood supply to this, so that if we do surgery tomorrow, the risk of bleeding is much, much lower. We'll err on the side of caution in terms of how much we'll take out to avoid any injury to the nerves or the muscles to his face.
This is what we've been waiting a long time for, eh, Kyle?
I don't want to do it like that.
No? Well, how do you want to do it?
I want to go home.
You trust Mommy to do what's best for you?
No.
Kyle, you do too. You do too.
You're my pretty patootie.
I like that. She's got her eyes open.
No, sweet girl. I've been through so much.
How are you?
Yeah, good, fine.
You have a good night?
Yes.
Yeah.
Exhausted and relieved that she got that. Still got a kidney in her.
It's done very well overnight. Kidneys continue to make good urine, fortunately. I'm very happy about that. And it looks nice and clear, nicely dilute, so hopefully.
You're just like my miracle that I prayed for
It
when you
is.
were
It
operating
is.
on her, because we
It is.
just didn't know what to think, you know, and it was so scary. And
So we're in good shape. I think we're in good shape.
Yeah, there's a bathroom downstairs, remember? Don't throw Sam. Sam didn't do anything wrong. Watch it.
Kyle, you're gonna get a little sleepy, okay? Mom's gonna stay with you.
Do you want to play that game?
Okay, so let's see if we can lie him down.
But just lie you down, okay, Kyle?
Okay.
It's okay. Here's your monkey.
Mom's here. It's just
Here's your
Mom.
monkey.
It's just Mom. It's just Mom.
Okay.
We're gonna take a minute.
Okay, all right. You look good care of it, okay?
Here we go.
Yeah. Oh, he's so scared. He's so scared.
Can I walk you out? Well, he's going to be fine, really. What we'll do is we'll come out. I'll come out as soon as we're done.
Well, we've got some urine leaking out of the drain, which is not unexpected. That's okay. I mean, it's once you cut across the kidney in that way, you've got the kidney's like a little sponge, and you've got so many little holes in it and it's impossible to seal them all off. So then what I'd like to do is just put a stent up in that, through the bladder up into the kidney without surgery, just with the scope, so that we divert the urine and encourage it to come down through the catheter that's in the bladder. And the sooner we can get her urine diverted out, the faster she'll heal and get back on her chemo, etc.
Yeah, okay, that's the most important thing.
Yeah, very good. Okay.
Thank you.
All right.
Okay, bye, Mom. Take care of her. Yeah, they will.
We're going to have a shot. You see the inferior calyces?
Yeah, there it is. And there's your leg.
Superior calyces?
Yep.
Let's push it more. Yeah, that's perfect. So, everything went perfectly.
Okay.
So we put you see here, we put the catheter inside.
And how long will this be left in her?
This we will keep it
For a bit?
at least nearly 3 to 4 weeks. When that drain here will start to give less urine, we're going to remove it.
Is that going to hurt her?
No, this no, really. She'll be happier without it. I think it will be really perfect.
Yeah, well, that's great.
I hope so. Okay, bye-bye.
Bye. Have they given anything for discomfort or?
Yeah, she had Tylenol, and she had something in the EMR.
She looks so pale.
She does look pale.
I'm just wondering what her counts were because looking pale is not good, Kala.
No, what we're doing is we try to identify normal anatomy. In this case, you really want to preserve his muscle that allows him to open and close his mouth. It's not as vascular as we would have expected. And obviously it's because Dr. Armstrong yesterday did a good job in embolizing it. It's really starting to swell.
Yeah.
It's looking good though.
Went well?
I hope, despite some swelling you see now, you're going to see a nice change. You'll get a general idea of contour.
Oh, I'm anxious to see him.
And, but unfortunately, overnight, he's really going to swell.
Yeah.
There's no question. And then hopefully over the next, probably by about 3 to 5 days, swelling will start to go down. And as you said, it'll be over the next couple months, we'll start to see the real change. But I think it's going to be worthwhile.
Thank you very much.
You're welcome.
All
right, we'll see you later.
Okay.
Hey, somebody's hiding their face. How are you?
I think I'm happy with how things have come along.
Good.
Yeah. So we're going to take the drain out now. Yeah. And from a surgical standpoint, I think we'll be done.
Done?
Yeah.
Oh.
Yeah.
So that's great then.
Hey.
Oh, thank you. That's great then.
All right.
Thanks.
Good.
I don't know how long it's going to be, but this part's all going to be flat. Yeah. Okay,
Oh my God. Jeez. Hi, Kyle. Mom's here. It's okay. It's okay. Mom's here, okay? Yeah. He was so terrified.
Was he?
The poor guy. Yeah. Oh, I gotta get out of me.
I'll get you a chair.
No, it's okay.
You okay?
Just,
You sure?
yeah. Kyle, you know it's all over now, eh? Okay, and you feel good about it? Good. Good.
Is he swelling up?
Yeah, he's swollen, yeah.
Oh yeah, he's really going up.
After 6 years of seeing that lip out, the first thing I said, oh my God, I had to get on my knees. I thought I was gonna drop.
Yeah, it's
the
gone.
lip is gone.
Yeah, it's going to be amazing, I think.
Yeah?
I'm hoping, yeah.
Okay.
We'll see you tomorrow.
Okay, thanks.
Hello. How are you?
Good, impatient.
Impatient for what?
Well, just nervous to hear what's happening.
Well, it's pretty good. The right kidney. This thing that had grown, it's not clear why it had grown because there's very little tumor in it. This was not a growing tumor.
Great. Oh, that's so good. And while she's on chemo, no more going to come on that one kidney that's left, eh?
It shouldn't. Now, can I write you a guarantee? No.
No, I know that's the one.
But I think that with the addition of a more powerful, more stronger chemotherapy, the chances of it recurring are very small.
So you'll get in touch with me when everything starts? And
Yeah, we'll just keep track of what's going on. So
That's
we'll
good.
keep in touch.
Okay, thanks. Thank you. No faking though, take a real drink. Oh, that's it?
You're too smiley. You're just too smiley.
I think that's the most you drank in one day, Calla.
At least she's got the glasses to protect her eyes from the straw.
Beautiful, Kieran. You're funny girl. Does she get the, what's it called, ventricular first?
Yeah. So what I'll do is I'll push some fluid through, and then I'll push the medicine in, and then push some more fluid through to make sure it gets to her. Big yawn.
Go to sleep on us?
It's gonna be over before you know it.
Do you remember where the clinic is?
So, what do you think? You think it was worth going through all that?
The girls think so. Adiane sure likes it. Hey?
Take a peek at you. Can I touch it a bit? Not gonna hurt you, okay?
Now, is that still swelling?
Yeah, he's still got a little swelling. But I think he's made a nice change. I
think it's a great change.
Kyle's surgery has been a success. He will be seen by doctors in 6 months to determine if additional work can be done to further reduce the malformation in his cheek. But Kyle is very pleased with the change in his appearance.
Calla, sit down. She's doing very well, aren't you, Calla? What are you up to? You're going to fall. I think maybe you should get out of that before you fall. You see, she's feeling better, definitely.
Oh, yeah?
Yeah.
We're going to be going Friday. We still get to go home Friday.
All right.
So she's all done now for blood work and...
Yeah, she's had some bloods this morning. There's no need to do any bloods tomorrow. She can go home.
Oh. Very nice girl. Give Daddy a kiss now. Oh, she wants to give you a kiss. Oh, your mom's girl. You're giving me a kiss.
After a month-long stay, Calla is ready to leave the hospital. She will continue chemotherapy treatments at a hospital in Sudbury, near her home.
Bye. Thanks for everything.
Doctors are hopeful that her future looks positive. The following events were recorded as they happened at the Hospital for Sick Children in Toronto. In this episode of Life's Little Miracles, Chris faces cancer, and Eric gets a smile. "17-year-old Chris Stevenson has been diagnosed with a cancerous tumor on his pancreas.
No more burning.
2 rounds of chemotherapy have not been effective.
You want to unpack some of your stuff, Chris?
Nothing in there.
There's nothing to hang up?
Nope.
No?
Just a t-shirt.
Today, Chris's parents and 3 brothers have brought him to the hospital for surgery to remove the tumor.
So what wrist you want it on? Because don't you put all your IV stuff in that hand?
Oh yeah.
Do you want to?
This one? On my wrist.
The operation is very high risk, but it is the last chance doctors have to save Chris's life.
So?
I checked with the, they got a video machine coming and the TV. She's gonna go and get one for any other side.
There you go. Sure, might as well.
There's Chris.
He gets the first 2 goals.
Does he really?
He's great.
Hopefully I'm playing hockey again by December, and that way I can get out as quick as possible and play as much hockey as possible.
Oh, you You should hear us down at the arena.
Okay. That's what my mom's doing all this.
Hi. Dr. Kieran, nice to see you.
Okay, just to recap, you have a tumor in the area head of pancreas. And it's an area where a lot of juices from different organs drain to help you absorb things you eat. Resecting the tumor itself requires removing not only the head of pancreas, but also the first part of small intestine that comes off to the stomach. It is a fairly involved procedure that has significant risks, including potential death from it. Has many complications, and I would expect a minor complication after an operation.
Now, and you mentioned about taking 50% of the pancreas.
The amount itself is not really critical, whether it's 50% or 60%,
Okay.
as long as there is an adequate tissue left behind to function. I'll probably make a sort of slightly, almost the shape of a boomerang. I think that will give us the best exposure. If you were a very narrow person, I would have considered sort of up and down type of a thing, but I think this would be the best way.
Cool.
Slightly asymmetric, but like a boomerang shaped.
All right. Yep. Very good. Thanks, doctor.
Thank you.
Take care. So.
Do you feel okay?
Yep.
What he said?
Oh yeah.
Yeah?
It's good to be able to be on those blades skating in no time. Of course. Yeah.
6-year-old Eric Canham has Mobius syndrome, resulting in malformed hands and facial paralysis. Eric has difficulties with speech and cannot smile.
No, I'm going to have some.
We have to take some more pictures.
Last year, Eric traveled from his home in Halifax for surgery on the right side of his face, giving him half a smile.
Very good. Hold the big smile. Hold it, hold it, hold it.
Now, doctors will attempt to complete Eric's smile by operating on his left side.
Very good.
So why don't you have a seat right here, okay?
Can we talk for a minute?
Can we talk for a minute?
Yes.
Of course we can talk for a minute. When did you have your first surgery? Do you remember?
In October.
In October. Remember what we did? We took a segment of a muscle from your thigh, and then we moved it up into your face, and we connected it so that when you moved your mouth, you'd be able to smile on that side.
What's that on the
That's my hat. What do you think? You like it?
It looks like a pirate hat.
Pirate's hat.
Oh, pirate's hat.
Can I turn the hat off? No, I did.
You want to put it on yourself? Having quite good success with this operation. It's not perfect, as you know, and it doesn't reconstruct every aspect of the facial nerve, but it does provide some support to their lower lip. It allows the lower lip to come up to the upper lip so that it improves their speech,
And it also provides a smile and simulates a smile so that they're able to interact more effectively.
He's very distinguished looking, isn't he, with his hat, Eric?
The doctor doesn't look handsome.
Oh.
What's
Thanks very much.
What's handsome?
You didn't have to add that last part. This part was just funny.
I mean, he's very good looking, Eric.
I'll see you in the morning, all right?
Good night, Dr. Zucker.
Okay, so hopefully we'll find out within the hour.
Thought he was supposed to go last night.
This morning.
Oh,
8
this
o'clock.
morning.
So that's everything's put on hold because of the there's a kidney transplant and they don't have enough ICU beds.
And if we find out that it is canceled for today, we better get on the phone to the people
Yep,
that were
that's
coming
right.
by, just to let them know.
They just called for him to go down.
Oh, you know what? He's definitely going to be going down now. We just got word.
No more waiting, eh?
Bye. Jeff said good luck.
Is that his brother?
Yeah, he's got 3 brothers.
Oh, wow. I'm just going to go see if they called for the transport to come take him.
Okay.
Okay, I'll be right back.
All right, thanks.
You just want to hurry up and get in? Yeah, I don't blame you.
You look a little sleepy, so it won't take much to put you to sleep.
I'm Dr. Kemp. I'm the staff anesthesiologist. We're just wondering, because for your form of pain management, the plan is to put an epidural in to keep you comfortable when you're awake.
How long will you keep the epidural in for then?
Probably for a few days. If you have, every time you cough or breathe, if it's your stomach and they cut across the muscles like that, it's kind of uncomfortable.
Okay, you want to say your goodbyes?
Okay. Well, we know he's in the best care in the world.
We'll take good care of him.
Yeah. We've known that for a long time. Okay.
Oh, I can't do that.
Sorry.
Shake my hand. We'll see you in a little while.
Yeah.
Where? Be good.
The dentition is all right, eh?
Yep.
Take good care of him. You'll be sleeping. It's the people that are awake that it's hardest for.
Eric, can you squeeze your lips together?
Do your best.
Oh, good one. Good for you. Good for you.
Good job.
Because now I want to see your big smile.
Great big smile.
Come on, come on. Oh my goodness, have you ever? Wow.
There's his dimple. Isn't that beautiful?
It's amazing. Look at that. Oh, 2.
Yes.
Oh, good stuff. Okay, let's just have a little try on here. There we go. So that will just sit like that. Looks good, Eric. I think it will do the trick.
Gee.
There we go.
The head anesthetist came out and talked to us once he was completely under, and they got all the tubes and everything, and so she said that went well.
I guess we should be coming up, huh? Very muscular. Probably has more muscle in this area than the entire my body put together. He's a hockey player, isn't he? Such a big trauma getting into the abdomen, isn't it? Yeah. We're in the belly. So this is the his tumor draped over a piece of his duodenum, and we mobilized it. We're just freeing it up to assess to make sure that this is resectable. A little more in the vesical area.
See you smile now.
Great big one. Your biggest one that you have. Great big one. Ooh, great big one. Nice dimples.
No, sit together.
It's Mom.
I didn't know you had this on.
I got dressed so I can go into the operating room.
Let me try this on.
Okay.
Oh,
Here's a little net, and it's got a smell of strawberries. You want to smell the little strawberries for us?
You go right ahead. You put it yourself.
Excellent.
So proud of you. Mama's big boy. Oh.
Okay, Mommy's just drifting off to sleep then.
Oh.
Okie doke.
Thank you very much.
Okay, sportsmen, let's just take this lump out. It's resectable, and if it's local disease, it is curable for this child. I'm quite pleased that it is. Okay. That's okay. We don't have to get into the second part. Okay, right. Tumor out.
What did you take out there, Peter?
Duodenum, pancreas. Come down into it.
Yeah, come on. Okay. Sit down. Well? Okay. And we were able to completely resect the tumor. The tumor was contained in the area. Looking at the rest of the abdomen around the region, everything looked like it was just contained in that area. He's got at least somewhere between, I would think, somewhere between 40 to 50% of pancreas left.
Oh, thank you so much.
Thank you.
Oh, gosh.
Thank you, Doctor.
You're welcome.
Thank you. Thanks for looking after us, son.
Not at all.
Well, now I better not go out there crying. I don't think it's bad news.
Is it okay?
Yep.
All done? Oh, that's good. All done?
Oh, I could have kissed him.
Yeah, well. As Eric's pillow, you miss Eric, don't you? You're wondering where he is. It's Eric's pillow.
This is the muscle which we prepared to put in the face, and it's been divided. It's now the right length to go in the face.
Okay, now we put the cheek flap back and we'll sew it up. So this is the hook that the occupational therapist made yesterday for him. And it will tend to reduce the likelihood of the already reconstructed side pulling against the part that we just repaired. So it just sits in gently like that. Everything worked out great.
Thank you.
The muscle sat in very nicely. It was in very good position. I was quite happy with it. Had an excellent circulation when we took the clamps off the blood vessels. The circulation to the entire muscle was perfect. Everything looks good.
Good.
Thank
Thank you, Dr. Zucker, again.
Okay, you're welcome.
Good work. Excellent work as usual. Thank you.
Thank you, Dr. Zucker.
He's all done surgery now. He's going to recovery.
I think he's all
I'm
finished
going to go
now.
see him later. You can give him a big kiss.
Hey, Chris. Dad's here, bud.
Is it gone?
It's gone,
It's gone.
baby. It's gone. they did the surgery faster
Sorry, bud.
than
Here.
they originally told us. But
Here, just put your hand down.
everything
Just
just
wanna hold your
went
hand.
great. No?
More.
Yeah, right there. We're just blowing it by his face.
It's drying up my throat.
You know what that is? It's humidified oxygen.
It's got humidity.
It actually will help moisten your throat.
It's really dry.
I know. That's because you can't drink right now, sweetie. Okay. Just
You're
a
the
little
bravest
bit of
guy
a
I've
temperature.
ever seen.
Chris, Grandma and Aunt Colleen are here.
Yep.
Uncle Rick's here.
Yep, they're all there,
Linda's
buddy.
here.
Everybody's there for you.
Kind of staying with us. Okay, can we just slow down a little bit? Say hi to your family.
There's Grandma and Uncle Rick.
Hey, buddy, how are ya?
Okay, like you
Yeah.
We'll see you when you get a little better.
Take care, buddy. Back to sleep.
Right.
Oh, we've got to stay here.
Oh, no.
You okay?
Oh, yeah. I've done this a few times today, Rick.
Yeah.
No question.
Long day since 6:30.
Yeah. Okay.
Hi.
Did you get Christopher?
Yes.
Okay, what time?
He's here now.
2
Just
seconds
arrived.
ago.
Can we have the admit team?
The calcium is 1.83.
Okay.
Next.
Okay. I'm just gonna get you all set up. Check your temperature and stuff. Okay.
You must be hungry, huh? You haven't eaten much since your surgery.
Tonight.
We'll see tonight what the nurse says is okay. You can have a Timbit, okay? But Dr. Zucker said you shouldn't have any today. Hi, Dolly. I like your shades.
He's had a great night. He's doing so well. Oh, yeah. Made you feel better?
Hey, that's not you. No, Franklin.
Big boy, aren't you? Did you know I'm proud of you?
How are you feeling?
Pretty good.
Pretty good. Any complaints?
Last night I got really hot.
Don't worry about these little oozes. I like it to be oozed out like that. This is why I taped it rather than sort of completely sealing it.
No, we were just asking this morning about the actual tumor that was taken out. And I was just asking if it was going to be examined. And Dr. Wales said, yes, it'll be dissected.
To them to slice them up into little pieces and examine all the edges of it. It will be at least a few more days.
Right.
I mean, at this point on, after surgical trauma, I feel, it's just a matter of waiting for him to heal.
Great, thanks.
Thanks, Dr. Kim. Oh, that sounds great.
Yeah.
Good for you.
This is Dr. Zucker's office.
Fabulous. Wow. You look so happy.
How much does it weigh?
I'll tell you. Big smile now on the other side. It's the same. 15 and 15. That's perfect. And here's a little hat for you. Alrighty.
I want day to calling Dr. Elwood.
What a good idea.
Right now, I got to do some operating.
You have to do some operating now? Okay, well, good luck.
Shake my hand before I go.
All right, shake your hand before you go. Wish you well.
Thank you, Dr. Zucker.
Oh, you're very welcome.
Thank you.
Glad it all worked out well for you.
Oh.
You'll be able to get more air down to the bottom. So let's try sitting up, see if we can have a listen to your back, okay? So, try and get your right elbow.
Our left side kills, that's the problem. The right side's fine.
Is it?
Pull it off. Okay.
Get it under?
All right, I got it.
Good. Are you okay? What's wrong?
Pain.
First time's always the hardest, Chris.
You're doing really well.
Oh, goodness. Fantastic.
Okay.
You okay?
Good boy.
All right.
Excellent.
Amazing.
Super.
You okay? There's a pillow behind you if you want to lean back.
While Chris is determined to regain his strength and play hockey, he faces a painful and challenging recovery.
Okay, do you think you can stay up for a little while longer?
I don't know. Lightheaded again?
Let us know how you feel. Do you want to go back to bed?
Stay up for a little longer.
Yeah.
Until pathology completes their examination, Chris and his family will not know if the surgery has removed all of his cancer. The following events were recorded as they happened at the Hospital for Sick Children in Toronto. On this episode of Life's Little Miracles, Sydney's chance to see and Chris's struggle with cancer continues. 17-year-old Chris Stevenson has cancer.
There's Chris.
Hopefully I'm playing hockey again by December.
After 2 rounds of chemotherapy, doctors decided to surgically remove the tumor from his pancreas.
It is a fairly involved procedure that has significant risks, including potential death.
Tumor out.
Is it gone?
It's gone,
It's gone.
baby. It's gone.
You're the bravest guy I've ever seen.
Now Chris faces a painful and challenging recovery, but he is determined to regain his strength and play hockey again.
Are you okay? What's wrong?
Pain.
Oh, okay. Here. I'll just hold this. It'll take the pressure off.
So my stomach. Your stomach hurt? On my back.
Back sore?
Stuff in the bed.
Okay. Is this better if you let it go like that?
I think it's just better if we hold it. Let's take the pressure.
I'll hang on it.
Okay, you gotta go back.
All right.
Okay,
Back.
go ahead.
Do you want us to push that thing? No.
Take it easy.
Here, I'll push this
got
so
it.
I need to get
How are you feeling?
You good?
Yeah? Are you getting hungry?
Well, yesterday I was really my stomach.
His stomach was growling,
That's
and I
good.
said to him, "Is that you growling?"
Yeah, that's good. Your belly is okay?
Yep.
Let me see. Okay, yeah. Those tubes will come out once you start passing some stuff down below. And I'm hoping that with the feed, we're going up fairly rapidly. And once that's up to a normal sort of volume amount, and then we'll probably get rid of that line in your neck. So that's just another source of infection. Either at the end of the day or tomorrow morning. 280. That's pretty good. Now, what time?
Sydney Invidiata is 4 weeks old. She was born with cataracts on both of her eyes and can only see light and dark shadows. Without surgery to remove the cataracts in the first few weeks of life, Sydney's visual development could suffer irreversible damage. Today, Sydney has come to the hospital for surgery to remove the cataracts from her eyes.
You're the perfect kid. Yes, you are.
That's right.
Are you ready?
No, but do it anyway. Then you get to cuddle with Mommy and Daddy. Open up the other one.
Oh. Yay, what are they doing to you? That wasn't too bad, eh? Yeah. We're okay.
So the plan for today is to remove the cataract from the right eye, and then tomorrow we'll do the left eye, because it's not safe to do both eyes on the same day. But I just want to go through some key details. While the baby's asleep, we'll make that small incision in the eye, go inside through the pupil, take out the lens of the eye, sew the baby up, a couple stitches that'll dissolve on their own, put a patch on. You'll stay overnight in hospital because of the baby's age. We'll take good care. That I promise you.
Okay.
Good. We'll see you.
Thanks.
Bye-bye. See you later.
Did you get all that? Yeah?
I guess you can like how confident he is, eh?
Yeah.
Makes me feel comfortable.
Me too. Me too.
Okay, I have to ask you a question. Dr. Kim wants me to take this out now.
Okay.
Are you up to it?
Yes.
Are you having any pain? Like, do you want some medicine just before? No? All right.
Should be okay.
This is just one tiny little stitch. All right. You ready?
Just one pull?
One pull.
How long is it?
Well, see, that's what I can't tell you because I don't know.
The nose tube thing went on forever. You kept
I
pulling
know.
everything.
And he may have made the drain a little shorter, or he made it really long. He might have cut it.
This one's long.
This one's long. That one's
This
short.
one I know goes up and around. Yeah,
Okay.
he's told us about that one.
Well.
Okay.
Yep. 1, 2, 3.
Oh, shit.
Okay. I won't pull. Take a big breath. Relax. Relax.
Oh, no, it's...
Okay, I know. I'm going to pull it out because it's... Okay. Take a big breath. 1, 2, 3. Big
breath, Chris.
Oh.
Gone. Oh. Gone.
Oh, man.
Keep breathing.
Big breath.
Inside.
I know.
Yeah, it's when you feel like you're being turned inside out again. I'm surprised she actually stopped. I thought she'd just keep going. Yeah.
There you go. Excuse me. There it is. There. Oh, nice. Look at how fine it is. I know. That hurts a bit, eh? No. I got a tube pulled out of me. That hurt. That ain't pretty. These guys brought you something.
Replacement hair.
Yes! Yeah!
That's what I'm talking about.
Now he's gonna strut. They said I'll be home Monday or Tuesday.
You're gonna come to our game?
When do we play?
I didn't. I know it's Tuesday.
I know we play Tuesday.
We've been pretty lucky today, I think. She's been pretty quiet.
She's been good for us.
I'm gonna be.
Okay, you all set?
You wanna give her
I already did, yeah.
Okay.
I'm at him.
Okay, Sydney.
Bye, baby.
All right, we'll see you later on. Okay?
Thank you.
Good look after.
Great. She's all hooked up now.
Okay, table down, please. Let's rock and roll. So you can see that the baby has a pretty dense white cataract. So we need to make a small incision. Unfortunately, there's no way to take out a cataract without sacrificing the whole lens because the whole lens is bad. And in a few days, we'll be giving the baby a contact lens to wear to replace the baby's natural lens.
what we've been asked to do is put in a PICC line. PICC line is like an IV, similar to an IV, either below the elbow or above the elbow. What's different is, what you don't see, is that the tip of the catheter sits very centrally, so it shouldn't really affect his mobility in any way. So of all the things you've been through, this is a walk in the park.
A little minor, yeah, that's for sure. Okay.
You warm enough, Chris?
Yeah.
Yeah?
Okay,
I'll see you, Chris.
See you in about half an hour or so.
Bye.
So we have a great vein, so we can tunnel it down to here.
You can feel it a bit, but no.
Yeah, it's going away. Okay, the little needle's going to go in now. That's the local anesthetic. Doesn't sting a lot, but it does sting a little bit.
Yeah.
Now the cataract is completely gone, and we just sew this up with 2 little stitches. Thank you very much, all. Good. See you, thanks. Everything went perfectly well. Couldn't have gone any better than it went. Took the cataract out of the eye, the lens out of the eye. There's not much to tell you. Everything went perfect. The research we've done shows that the baby's like a newborn. She's what any newborn would be, so now we go into a catch-up phase. Now, that catch-up phase is pretty fast, and that's what we hope for, is that the brain can relearn all the way, be like a normal baby, and if so, then we're sailing.
Right.
Appreciate it.
My pleasure. Take care.
Thanks again.
Okay.
All right.
She's in the bathroom.
Okay. Here's my girl.
She dozed back off to sleep, but when she wakes up, you can give her a bottle.
Okay. Hello, my Belfie. There you are. You got her. Sydney. Hi, baby. Are you okay? We're here for you.
It's okay.
Okay, we're almost there. How's it feel, Christopher? Not feeling anything, good. So you'll be able to see the site. All right, Christopher, you're done. Okay.
There it is.
How was that?
Neat.
That's it?
Oh, yeah.
So sterile, that's the sterile part.
Yeah. No, they gotta take this neck line out.
This has been in for how long?
2 weeks.
Yeah, 2 weeks today.
How long is it? I'll show you.
That's pretty long.
That's how long it is. There, we get rid of that.
That's good.
So it's definitely an easier line to look after.
Freedom in the neck. That's great.
All right, so we'll put a Band-Aid on here.
People will be asking, what's that for?
Make up stories what it's for.
Good for you.
You're gonna like this, baby.
Yeah, I'm not gonna like this at all.
Do you wanna,
I'm gonna hide my eyes.
you gonna stay in here?
Yeah, I'm gonna stay, but I'm not gonna watch.
The object is to get this little edge under the baby's upper lid, okay? The key is not to be afraid to touch the eyeball. You have to let your finger go in and touch the eyeball, okay, in order to make it stay in. You ready?
Yeah, he's ready.
Good.
He's ready.
There you are. No, I'm not.
So I'm gonna help you a little bit here, since it's your first time. And all you're gonna do is try and get that little edge up under there. Good. Just ignore the crying if you can. Okay, so feel her eyeball. My finger's completely between her 2 lids. Okay? Okay?
Yeah.
Okay. I think you did a good job.
Yeah, we'll get used to
You were halfway there. The first night is tough.
Is it?
Okay? Because you're all by yourself out there and your baby's crying and screaming. You feel like you're mean, awful human beings because you're doing this to your baby. You just gotta hang in there. Don't panic tonight. There, do the best you can.
There it is, eh? What it is. Up to the MPO.
Well, that was for the, I couldn't eat for this.
How's
drinking.
the drinking liquid part going?
Pretty good. I can drink.
Good. But that doesn't bother your tummy?
Nope.
That doesn't change anything in terms of drainage?
Nope.
It's so much better with the line down there, isn't it?
Yeah, so much.
But the plan is to wait probably about 5 to 7 days just to stay on clear liquids, carrying on with a TPN, and just a matter of waiting it out anyway. So it's a little frustrating, you know, and people do get cabin fever after a while because you feel so well.
Right.
Patience. Grasshopper. It will get there.
Musuria, mi Willy, musuria, mamá. Se fez de musuria. Se fez de musuria, mamá. Se faz outro confortável, só. Se faz outro confortável.
Dr. Emily, how are you? We did get the new lenses.
So is everything taken care of now?
No, because we're having the same problem.
What's that?
The right lens is dislodging and we're finding it under the upper lid.
Okay, it's supposed to move, that's normal. So how much is it moving is what I need
It's
to know.
like right up in the corner.
Both of them are doing this?
Just the right one.
Okay.
The other thing it's doing is it's flipping out.
Okay, well, let's take a look. So we just take a look and see the health of the eyes. That's good. Remember, we'll want to...
This is it?
We hope so.
Yeah? How are you?
Good. I just spoke to the pathologist and the whole thing is completely resected. Margins are clean, so it's completely resected and there's nothing left behind. It was curative. Okay?
Excellent.
Now, when you get home, what you should do is no different than what you do here. Gradually resume more and more normal activity in terms of sporting things and so on, whatever you want to do. They shouldn't sort of prevent you from doing it. Key thing to do is to get your strength back and see if you can get your weight back. You lost about 7-8%, but I think you'll gain it back. You've done well.
Oh yeah, got this for you.
Oh.
Newmarket shirt. You know, from me.
It's very nice.
From Newmarket.
Thank you very much.
Thank you so much, Dr. Kim. We really appreciate everything you and the entire staff have
It's
done.
my job.
Just get you dressed, get you out.
Bye. Thank you. Okay, bye. Take care.
We'll come and see you in 2 weeks.
Thanks. We'll see you soon.
Are you excited?
Yeah. Very.
You'll be home when everyone gets home from school.
Mom's been having some problems with the fit of this lens. I think if they made the optic a little bit bigger, it would work better. Good. Okay, we're done. I'm gonna go talk to Mom.
Yeah.
I don't know. It's just frustrating.
With?
The whole contact lens thing.
And if the lens isn't on her eye, it's falling out or it's folding or it's riding up,
It's not good.
and she's not using it as much. So it's really a choice you have to make, how comfortable you are with the current situation or if you want to try something else.
I'm not comfortable with the current situation.
The problem is very simple, and that is because your baby's eyes are a little bit smaller than normal, she needs that higher power than normal. The higher power lenses, once you get above 32, we have to switch companies. The other company's lenses have a smaller firm area in the middle. This lens is much more floppy than this lens, and that's why you're having some of the problems you're having. What I would suggest is that we switch her over to a 32 in this eye and give her temporary glasses to make up the difference between the two, okay? I think this is a good option. I really would recommend we try this, okay?
Well, welcome. Hello, Sydney.
How wonderful you look in your new glasses. And what we're going to do today is our strike card test to see how her vision has changed since the last time we saw her. So if you'll just take her glasses off, I'll get a patch to put over her left eye. Yeah, this patch is going to be strange for you, isn't it, Sydney? Oh, isn't that strange? And if you put her glasses back on. Good girl. Are you all set to go? That's great. Okay, here we go. Where are you, Sydney? Where are those stripes? You think they're over there? Where are they? That's a good girl. That's a good girl. That's good looking up here. You told me properly.
And the lenses are no problem. It's like second nature to her. She doesn't say boo.
I think parents get some credit too. Oh. I'd say the parents are pretty great.
Sydney is now 6 months old. Her visual development continues to accelerate, and her parents are looking forward to her progressing toward normal vision.
Hey, how are you?
How are you?
See you.
Nice to see you again.
Nice to see you again. How's your weight?
I gained 5 pounds.
So about half of what you lost?
Yeah, or so, yeah.
Okay.
And then that was within the first week and a half or so, and then I haven't gained anything since.
Well, that's okay. Is there anything you cannot eat?
No, just stuff that I don't like.
You okay?
Yep, I can't feel a thing.
Good. That's what you want. See how long that was, huh?
That's quite the line.
Yeah.
That's cool.
That's cool.
Yeah. When do you think I could play hockey?
Whenever you feel up to it, including this week, next week.
Yeah. My team just played yesterday.
What position do you play?
Center.
Oh, that's good.
Come on.
Just 7 weeks after surgery, Chris is ready to join his teammates on the ice.
Okay, here we go, Eddie. Here we go. Get it up, guys. Right there. Keep it in. Yeah.
He got that one, didn't he?
Doctors will continue to monitor Chris's health, but are hopeful that his struggle with cancer is over. The following events were recorded as they happened at the Hospital for Sick Children in Toronto. On this episode of Life's Little Miracles, Luca visits the ER and Emily's chance to hear. Luca Calabro was born 1 month ago. For the past 6 days, he has been vomiting. Now, Luca is not eating at all, and his parents have brought him to the hospital's emergency room.
It's been 6 days now that he's been throwing up, but it's not the small throw up, like that's the big, how do you say that in English?
Projectile?
Oh yeah, and he throw up all the bottle, like he doesn't keep nothing in his stomach. And since yesterday, 5 o'clock in the afternoon, he didn't eat nothing.
And how about his color too? Does he look different? Hello.
He's more lighter, like he was more red, you know? And he lose a lot of weight too.
How much weight do you think he's lost?
700 grams.
How old is Lucas?
A month.
1 month.
How old are you? T'as quel âge? 3 years. 3 years old. You're a big guy. Okay. He's a bit dry, so I think we will get some fluid into him as well right now.
I know. Very excited. For me? Is that for you? No, this is for your brother. Kind of like giving him a special drink. Okay.
Shauna and Monty Ackerman are the parents of 2 profoundly deaf children. 2 months ago, their 2-year-old son Ethan had surgery for a cochlear implant, where electrodes were implanted into his cochlea. The implant acts as a receiver transmitter that stimulates his hearing nerves. Now, the Ackermans' 1-year-old daughter Emily is being prepared for the same surgery that could allow her to hear for the first time.
I'm here.
It was hell with Ethan, and I think we're more nervous with Emily.
Well, for the hospital stay.
Just for the surgery in the hospital study, because we didn't suspect, you were in with Ethan for 7.5 hours.
This next one, I think the radiology, the CAT scan is really quite interesting. I looked at the films in her cochlea. It's a little more, well, it's hard to say, it's a little more abnormal than his was. Normally, they're routine surgeries, but they aren't going to be with her. So.
Right. Well, we'll probably be in the hospital for a few days.
Mm-hmm. Yeah, because with Ethan, there was a little leakage, and then it leaked quite a bit.
Right. Ethan's leak was so substantial that it actually made it difficult for me to actually get on with the operation. Right. We know the operation is not going to be an hour and a half walk in the park because her brother, whose cochlea was more normal, didn't take an hour and a half, and it was 7.5 hours. So this is a very complex case. We wouldn't have even tried this 5 years ago.
Ready to go? You're coming too?
Yeah. Sure. Think he's going to leave me? No way.
So there's a problem between his stomach, where all the food goes into, and his small bowel, which is where the food goes afterwards. Between those two, there's a little channel where the food has to travel through. And the muscle that's around that part of the bowel is pressing down so that fluid, his food, can't go through that little area. And that's why he's been vomiting. So he'll need to have an operation. It's a small operation to fix this problem.
And it's from inside or outside the operation?
The operation, we have to get inside, find the stomach.
Can you do it by the mouth? Or
No. It has to be through a small little cut like that. It'll be right near his belly button. Okay. What we'll need to do is check his blood work that was just drawn. And usually babies who have this problem, because they vomit a lot, they tend to have their electrolytes are abnormal. We need to make sure those are corrected, then we can plan to do the operation. Okay? Okay.
That's a very loud sound for her to hear, and that's low frequencies. And most children who are hearing impaired can hear beep beep or and she doesn't hear it.
How can you not hear that? It's so loud.
How children learn to talk is through listening to their own voices and the voices of others. And when children have a hearing impairment, they can't hear themselves very well. And so what we do is we try to make sure that she has the most optimal hearing technology. And so we're going to try a cochlear implant.
Yeah.
And cochlear implants will hopefully give her the ability for her to hear her own voice so that she can learn to talk.
Well, when I work with Ethan with the hearing, putting things up to his ear, she now starts to put it up to her ear. She's dying to learn.
I hear you.
Yes, I know. No.
Sorry, Mom. His first set of blood work, the electrolytes are abnormal, so the chloride and the potassium are fairly low. So we need to give him some more fluid, and we'll check his electrolytes again at midnight and then in the morning, and then we may need to give him more fluid through the night, or he might his electrolytes might get better, which that means that we won't operate tonight. It'll probably be tomorrow. Okay. Okay? I'll see you later.
There we go.
You want to come to Daddy? Come to Daddy.
Up.
No. Hey guys.
Hi.
Good morning. How you doing?
See, we're ready for you.
Yeah? No, I got a half hour. Jim Reck is going to come by, neurosurgeon, talk to you about the drain.
Okay.
You suspect that you will have to put in a drain?
Yeah, but I might not, but I suspect I will.
Right.
Be careful, like, just shave the underneath, leave the long part,
Yeah.
so it covers.
Shauna, Dr.
She's-
Patterson's a surgeon, not a stylist,
Tell
okay?
them.
This is Dr. Rucka, who I told you about.
Hi, nice to meet you.
Nice to see you. Very nice to meet you.
This is Emily.
Okay, thank you.
Did Dr. Patterson explain to you what we might be doing today, if necessary, from our standpoint?
Yes, a little bit.
If Dr. Patterson finds that there is a leakage of some of the brain fluid out through the wound, a significant amount of it, then he has requested us to insert one of these drainage tubes that goes into the back to take the pressure off the wound. And we may not be needed. Right? So I'm just here by
Hopefully
standby,
not,
and if you
but most likely.
don't see me again, that's fine too.
Yeah.
Okay, all right.
Thanks anyways.
Okay,
Bye.
okay, thank you.
Soon, Emily.
Now I'm gonna cry.
Mom and Dad can go to the surgical waiting room. Okay?
The cochlea is normal. No, this is a very abnormal cochlea. Her older brother had one about 6 months ago and had a very substantial leak from the cochlea. We needed a lumbar drain. Because once you hit the cochlea, it's going to leak like crazy.
Who's this? Victoria. The electrolytes, they were really abnormal. They were really low. So it's going to take a little while. Now we may be able to do it tomorrow. We'll just, we'll see.
I'm very worried about that doesn't eat nothing.
Well, there's no way to feed him because the muscle is too big. So anything we put in his stomach is going to just come right back up again. And we're giving him some sugar intravenously, so he's getting some calories from the sugar.
So I hope it's for tomorrow.
Me too. Keep
Not seeing him eat, that makes me feel so bad. Today you can tell he's hungry.
I don't know, I hate this weight.
Okay. Okay, this is the device here. This is dried and she's so delicate. This little baby girl. Okay, that's perfect. Okay, microscope. Like that. It keeps on throwing it out, but if I can get it to stay like that. This part is abnormal, so that's why we lost our ballet-like groove, because this is all sort of thinking on our feet. Tell Jim that I'm not going to need a lumbar drain. There's
Okay.
Tell him to my great delight, he's off the hook.
Okay, where will you go? Oops, here, hold on. Okay. All right?
Yeah.
Take good care of you.
Okay, thank you.
I'll show you where the waiting room is.
Okay.
He's just fixing his cheeks.
The belly button is itself a scar. So to make a scar around the belly button, you can hide it pretty well. And before this operation was designed, a lot of these babies died. And this baby was really sick, actually.
All done.
That was quick.
Very little bleeding, very little hair shaved.
Oh, good.
The cochlea didn't leak at all.
Oh!
Amazing.
Amazing.
That's incredible.
Put the electrode in and it went in easily.
Okay.
But we just sort of tested now to see if they're in contact with tissue, and all but two of them are touching each other, so they won't be used.
Same as Ethan,
Same
though.
as Ethan.
So that's we're just doing the mapping and all that stuff now and securing it in place.
Yeah, that's good news.
I'm very happy now.
Yeah.
See what we get. So on the screen you see a whole bunch of reactions, some auditory, some from the facial nerve. It's encouraging.
Karen and I just finished. When we have a child with a cochlea that's abnormal, we're seeing the responses, but we're not always sure if it's a facial nerve we're seeing respond or the auditory
And you
nerve.
had that with Ethan, too?
We did. And we're not sure really until we switch her on and we see what she does to her.
Okay.
We're looking at this data and we see that there's something going on. We're just not sure quite what it is. So we're hopeful.
Okay, fingers are crossed with her.
Yeah.
There it is. Okay, so there's the thickened pylorus. It's really thickened in this baby. Okay, knife, please. That's good. Splitting the muscle and opening it like that, it allows the food to pass from the stomach into the duodenum normally. There you go. See that? That just sort of cracks open like that. Okay. So the pyloromyotomy is done, and now stick it back inside. Good. We're done. Went fine. Yeah, it was a typical pyloric stenosis. No problems at all.
He's okay.
He's fine.
Okay.
We put some numbing medicine in there so he shouldn't be too sore. And he was vomiting for a week,
long
so
time, yeah.
his stomach may have lost its
Yeah.
tone a little bit. It may take a couple of days to get him back to where he was. All right?
Yeah, thank you very much.
You're welcome.
Also, put him inside the... So since he's inside here, I can hold him, right?
Well, when he wakes up, I'll get him out for you. You can cut him. No problem.
I will still never do up her diaper yet. Still.
He looks good.
Yeah, he looks really good.
Okay. Yeah.
Soon you're gonna hear your mommy and daddy.
Yeah, the bandage will come off tomorrow. We can go home. Okay. Okay. T'es en colère déjà pour le matin? Okay. You're gonna see the monster. Les peaux.
Bobo?
Ça y est, plus bobo.
Plus bobo?
Il vomit pas ça? Plus bobo.
Pas vomir?
Non, il vomit plus.
Pas bobo?
Non, il n'a plus bobo.
Maman, viens un pote, maman.
Mets-toi de l'autre côté. Allez.
So when I say 1, 2, 3, I'm going to be presenting a sound. Kim and you will watch her. If you see anything, let me know. 1, 2, 3.
No, that's just
She's
clay.
trying to fake us out. 1, 2, 3.
See?
Straight up, Emmy. Hi.
Yeah.
I love it. I love it. Oh, my poor baby.
Yeah. So tomorrow you do the same thing.
And we're going to turn it up louder tomorrow.
Right. And then next week you turn it up
louder still. Today everything's just soft.
Right.
Oh, look who's here. Hi, guys. Hi, Mackenzie.
So, Emily, what you have?
Wow, special ear.
Right.
Can you count for Shauna? Say it loud.
5, 6,
7,
8, 9, 10.
How long has she been hearing for now?
17 months.
Wow.
So if you wait, she doesn't shut up. She's always.
I can't wait.
I know.
Peekaboo, I see you.
Oh, she's blowing you a kiss.
I think he's cuter since we operated on him.
Sure.
What do you think? Are
He's
you cuter?
getting bigger.
Are you cuter? Yes. Let's have a look at it.
I can get him to speak to it.
There we go. Yeah, there it is. And he's clearly gained some weight, huh?
Oh, yeah.
Okay, it feels fine. He's all better. That's it.
Yeah.
We don't need to see him anymore. If there's any problems, let us know.
Okay, so thank you very much.
You're welcome.
Okay.
Take care.
Thank you.
Bye-bye.
Bye-bye.
Luca has fully recovered.
Bye-bye.
Now that he has had his surgery, he will continue to be able to eat well, gain weight, and develop normally.
Did you hear that?
You heard me. You were listening. Good girl.
Hi, Emily.
Oh, that was good. Emily, you heard that. You heard that.
Those are good responses for the amount of time that she's been listening.
Monty called her name the other day and she went like this.
Yeah.
Right?
Right. So I don't think she knows her name, but she's definitely hearing.
Emily and her parents will continue to work with therapists for several years to develop her listening and speaking skills. She is making progress and is clearly benefiting from being able to hear sound. The following events were recorded as they happened at the Hospital for Sick Children in Toronto. On this episode of Life's Little Miracles, Julianne arrives from the Philippines. Eight-year-old Julianne Noguera and her father have traveled to Toronto from their home in the Philippines. Julianne was born with a growth on her face caused by brain tissue that has pushed through a hole in her skull. Treatment is not available for her at home.
You can come out of a seat over here, okay?
The hospital's Herbie Fund for International Children and the local Filipino community have arranged for Julianne to come to Toronto for surgery.
Great. Can you give me a big smile this time? Okay. There we go. Okay, that's it. You're all finished. On your way.
Hi, Julianne. I'm Dr. Forrest. How you doing? Welcome to Canada. You look like you're all bundled up for the winter. Julianne, do you speak any English? You speak a little bit? Just a little bit? Can I have a look at you? Is that okay? Julianne, does that hurt when I push?
Masakit daw.
A little bit? Okay, I'll try and be really gentle. Can we have a look inside your mouth?
Ibuka mo yung mouth mo. Bigay ka ng sound.
Good. Good. And then show me your teeth. Do that.
See my teeth.
Excellent. You have a very pretty smile. What we're planning to do is a very complicated operation. And what it involves doing is myself and Dr. Rutke, who's the neurosurgeon, it involves removing this encephalocele, which is basically a collection of tissue that's pushing out from inside the head through a hole in this area in here. But she will require an operation where we make an incision across the top of her head so we can lift the skin forward, we can remove the bone, and then safely we can remove this tissue. Now, the other thing, just looking at Julianne, it looks like her right eye is pushed outwards. So we need to move the eye closer to the middle to match the opposite side. We have to be very careful of that when we do the surgery. We have to be very careful of the muscles and the nerves that move the eye. The other thing that we're always concerned about when we do this operation is if we're operating around the brain and we're trying to close the hole where the tissue came out from, sometimes we can get leakage of fluid from inside the brain out through the nose. And that sometimes also requires another operation or the use of a drain. Would you like me to show you some pictures? Thanks. This is a child who came from the same part of the world that you came from. Here she is before. And she looked quite similar to you. And here she is after the surgery. Do you think she looks better? If you looked like this, would you be happy? Okay, well that's what I'm going to do, okay? I'm going to try and make you look better than that. We're going to do our best.
Okay, have you had an MRI before? Have you had this test before? No? Okay. All right. Come on in here.
Whoa.
Very easy. You just have to hold nice and still for me. Good. You can have a nap if you want, okay? So you have to hold very still while I take the pictures. I'm going to put a little strap across your forehead to hold your head nice and still. Okay, we're ready. Are you ready? Here we go. Okay, hold still. Okay, Julianne, the next one is ready for 4 minutes. Hold very still. The table's going to move a little bit. It's pretty boring in there. There's not much for her to look at. She's just laying in there listening to the noise, so it's easy to get distracted. She's had it, I think. How you doing, sweetie?
Nice to see you. Yeah, nice to see you. Welcome to Toronto. Nice to have you here. Hi, sweet. Yeah. Oh, yeah, our pleasure. Hi, Julianne. How are you? It's a beautiful name. I'm here today to answer any questions that you might have regarding the procedure that we have planned next week, Thursday.
How long will the operation last?
Dr. Forrest and I will work together on this basically for the better part of the day. So we'll start at 8 o'clock in the morning and likely finish by mid-afternoon. After I get the information from the MRI scan, I'll be better equipped to inform the family of benefits and the risks might be of the procedure. Are there some problems that she faces either in her country at school or with friends or something?
In fact, one of the real concern and problems of this regard is the teasing, constant teasing with classmates. To be honest, I'm really amazed. She still maintains to be a nice, well-mannered child.
Well, that says a lot about her
yes,
as a
person.
person.
A lot about her, yeah.
Morning, Mom.
Just restroom. You want to sit down?
Oh, his nose is big.
His nose is big.
D.
Oh.
Z. V. E. O. L.
Very good, very good. Look at me. Touch the pencil. Good. Watch me, please.
Oh,
touch the
tingin lang
pencil.
dito sa
Good.
kay Doktor.
Watch me. Touch the pencil.
Oh, that's the being said.
Okay. So her side vision is fairly good, but this eye has not. It's been surrounded by all this extra growth, and it's grown up very differently. It's a very short-sighted eye, and it's a very lazy eye. So she has one good eye and one not so good eye. She cannot read with the same.
Is she be okay when the right eye repair?
I think that her vision will stay the same. The operation is not going to affect the vision in her right eye. It won't make it better. You were really good. Thank you. How do we say thank you in Filipino?
Salamat.
Salamat.
Maraming salamat.
Maraming salamat.
Yeah.
Okay.
That's.
Thank you very much.
You very much. Malabuti yung mga wala kang pala. Eh, bakit? Ayusin mo, kunin mo itong isang deliver mo. Tanda. Yung deliver mo pang isa, may pangalan na yan. This is my mother. He's come over from Calgary. This is my sister.
Pwede na ikaw? Takot ikaw? Oo. Kaganda na ikaw. Ano din eh? May damit ikaw pula.
Gaganda na
tuloy siya.
I love you, beautiful. Saan po kayo, taga Maynila po kayo? Julianne, ako si Linda.
Linda,
Ako sa... Linda. Auntie Linda. Sa operating room ako.
Sa operating room.
Kami ang gagawa sa kanya.
Okay, Julianne. Punitan na tayo mamaya.
Ayan, okay. Mauwi ka sa Pilipinas. Maganda na.
Okay, sasama ka sa akin. Gusto mo sa akin?
Julianne, how are you? How was your weekend?
What we call the Santa Claus parade.
Oh, excellent.
We went there.
Yeah? Can I have another look at you? Is that okay?
Oh, yeah.
So the plan is for Dr. Rutka and myself to remove this, and then I'm going to need to reconstruct on the inside of the eye, the floor of the eye socket, the nose, and then part of the upper jaw. It'd be nice to get rid of that, won't it? So I'll see you in there shortly, okay? All right, thanks.
Okay.
So, wait, ikaw na ikaw namin na.
Galing po sa Calgary sila kaya.
Sige, at lalabas na lang ako. Pagkatapos niyo matulog, lalabas na lang ako. Sige na kayo. Bye. Okay, bye.
Bye-bye. Thanks. Dito na lang kami. Tita Linda.
Come with me. We'll take you to the waiting room.
Yeah.
Nilagay ko yan, makikita mo yung heartbeat mo doon. Tug, 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 sabi niya. O, tingnan mo ha. Isa dito. Mali.
Yeah, well, she just wants to explain what she has.
Isa dito.
Can't or give you what.
Okay, Julie. Julie, sige. Di ba rin? Di ba rin? Hindi na natin na ano. Huwag ka lang muna. Huwag ka lang muna. Huwag ka lang muna. Huwag ka lang muna. Okay, wala na, wala na.
Yeah, no.
Make some room here. Let the brain surgeon in. What we have to determine, and what's not fully clear from the operative images here, are two things. One, how much brain tissue might be in this sac, and two, how big the hole is that leads from the base of the skull into the nasal mass. We can see on this image here that the hole looks like it's about the size of a dime in cross-section, and that's the escape hole through which the intracranial contents go. Most of the contents of the sac that is sitting in front of the face is comprised of fluid as opposed to brain tissue. The less brain tissue that has to be affected or discarded at the time of surgery, the better the outcome.
Knife, please. Okay to start, Jerry? 16 blade, please. So at this point in time, we have everything exposed. Here's the frontal bone, and we're right down to the level of the supraorbital rim, right here, and here, which is the upper portion of the orbit of the eye socket. And what we're going to do is elevate some of this tissue and bring it forward. Thank you.
Okay, so okay naman siya. Nag-i-start na sila. Kaya, okay na.
Huwag na masyado mag-alala.
Oo, huwag ka masyado mag-alala. She's in good hands.
Yeah.
Alam mo na? Oo.
What we're doing right now is we're dissecting the sac off the inner contents of the orbit, and there's some vital structures in the area. The muscles that move the eye are very close, and then just behind all that, the optic nerve, which provides the vision. So this is a tricky area because the tissue of the encephalocele looks very similar to the normal orbital tissue. It's a little tricky. We've come around that quite nicely here.
Okay, then we're ready to go. I mean, as far as I'm concerned, because I can close the dura, and then you guys can. So we'll scrub in. How's that sound?
Sounds good.
Hey guys. This is the stalk. So this is the communication between the brain, which is here, going out the face, which is down this direction here. So we can cut across here, just between the two. Now we're cutting across the stalk. Okay, now they're separated. This brain tissue that was coming out into the nose is non-functional brain tissue or dysplastic brain tissue. We've got the dysplastic brain tissue out of the picture, and now we can close the dura overlying the brain so that then Dr. Forrest can come and do his reconstructive procedure. Scissor?
So Joy, I think it's about, by this time it should be over in the next 10 minutes.
10 minutes? Okay. I'll wait.
Tomorrow she will be a different person. Yeah, and glad to be here with my brother anyway. I thought we'll never make it to be here in time, but we were able to. So it's nice to be with him during this hour. Yeah.
Hi. Nice to see you. Yeah, nice to see you again.
Nice to see
Thank
you
you for
again.
coming today. Yeah, very nice. Nice to see you. Hi. So basically, the critical part of the operation has been completed now. We've been able to disconnect the encephalocele, the sac from the face, from the intracranial or the brain, and that has gone extremely well. There's been no problem so far. Now, Dr. Forrest is busy working with the reconstruction aspect of the procedure, especially concentrating on the eye on the right side, but he'll come out and talk to you more about that.
Okay.
We thought we'd give you this update at this time.
Yes.
Okay? Very well.
Thank you.
Pleased to be able to help out. Okay.
Thank you.
Bye.
Doctor. Bye-bye.
Okay, bye-bye.
Hey, Julianne, say goodbye. There you go. So lovely.
All right, man. Nice, yeah. Sacrificio. Dahil may sacrificio nila.
We've reconstructed the nasal pyramid quite nicely in here with the bone graft that we've taken from the skull. We've also reconstructed the rim of the eye socket here, and this little piece of titanium mesh is reconstructing the floor of the eye socket to provide good support for the globe. So we're on the home stretch, but it's these little details that really make the case turn out better in the long run.
This is the last stitch.
Drum roll.
How are you? Good. We just finished.
No.
She's awake. She's
awake?
She's awake. Yeah.
Good.
And she's on her way to the intensive care unit.
Yeah.
Everything went very, very well.
Yeah.
We were able to remove the entire sac, that whole encephalocele, and we were able to reconstruct her a new eye socket, bring the eyes closer together, and reconstruct her nose. So I think she's going to look a lot better. I was very pleased with the way things went.
Yeah.
Okay.
On behalf of our family, thank you, Doctor.
Oh, it's my pleasure.
Thanks.
Yeah, it was my pleasure. She's just on her way to the intensive care unit. When she gets settled in, you'll be able to go and see her.
Yeah.
And I'll see you tomorrow.
Yes, Doctor. Thank you very much.
All right. Okay. Bye-bye.
Okay, bye-bye.
Bye.
Congratulations.
Yeah, that's good.
That's good.
Very good. She will look much better. Yeah.
Yes. I'm so happy.
Hello.
Yeah?
Have you seen her clever?
Yeah. Papa, itu si Papa. Sige. Okay, anak ko. Okay lang anak. It's okay.
Julianne has survived the massive surgery to remove the growth from her brain. She is at risk of developing complications and will be closely monitored. It will be several days before her swelling reduces and her family will be able to see the complete change in Julianne's appearance. The following events were recorded as they happened at the Hospital for Sick Children in Toronto. On this episode of Life's Little Miracles, Julianne's transformation. Eight-year-old Julianne Noguera and her father have traveled to Toronto from their home in the Philippines. Julianne was born with a growth on her face caused by brain tissue, which pushed through a hole in her skull.
What we're planning to do is a very complicated operation. If we're operating around the brain and we're trying to close the hole where the tissue came out from, sometimes we can get leakage of brain fluid.
A team of doctors worked for 14 hours to remove the growth and reconstruct the bones in Julianne's face. The massive surgery puts Julianne at risk of developing complications. It could be some time before Julianne can return to her mother, who remains in the Philippines with Julianne's brothers and sisters.
Maigi ka na. Masakit. Kailangan na. Isang araw na lang gagaling ka na.
Hi.
Hello.
How are you?
Fine.
How's Julianne doing?
She's doing fine. She said she wants to go home. She wants to sit up. As we say. It's okay. No, wala. No, hindi ka nila gagalawin.
It's okay. I'm just gonna have a look.
Doktor mo.
I'm just gonna look. Okay. What she's going through now is very normal with the swelling. She'll swell so much that the eyes won't be able to open properly. And that usually starts to get better after the second or third day after the surgery.
Probably tomorrow.
I hope so.
Yeah. Kasi sabi ni doktor, okay ka na raw. Tapos yung mata mo, isang araw na lang, magbubukas na yan. Ha?
Good. Okay. This is the hard time, really.
When you get better, you go home. Don't worry.
Hi, Dad. How are you? Good morning. How's Julianne today doing? Hi, sweetie. Good morning. We had some concern about some fluid that was just tracking out of the eye. We're going to have to continue to watch over that.
Oo, ganyan. Green. Green. Nini, we go to the bathroom and go see yourself at the mirror, huh? Oh, look at yourself and the mirror. Oh, supply ka.
Ayaw ko, masakit yan.
Hindi, dahan-dahan lang kayo, tingnan mo. Oh, ayos pa, tingnan mo yung sarili mo. Ay, imuklat mo pa yun siya. Itanos mo pagtingin mo ganyan. O, pilat. Kasi sugat yan ay. Itanos mo yung kanyang tinang ganyan o. Oo, yung muna o. Wala na yung kung mo baga o. Ano? Wala na. Aalisin yan baka bukas o sa araw.
Ganda po dito. Dito.
Tingnan mo. Wow. You look new again. Look yourself. Tingnan mo. Kukunin ko. Your tears is pouring down. Ano? We're
gonna take out your stitches. The easiest way to do this is we'll just take out 1 or 2, and if she doesn't like it, well, then we'll stop.
Oh, Nini, papahigain ka daw dito, tapos... Ayaw, mahiga kahit maalis na yan.
Ayaw ko mahiga.
Oh my God. He don't want to lay down.
You don't want to lay down?
Oo. Eh, paano yun maaalis kung hindi ka higa?
Ayaw ko mahiga.
Lalagyan ng bandage. Wala na daw. No more?
No more. No more? No.
No more.
No more. Just a little band-aid. Just a bit more.
Oh. Close your eyes. Kalinisan.
Mata mo.
Oo, yan. Oh, nilinisan yung
dry.
mata. Close your eyes. Hindi, oo. Inaalis yung muta.
There's a small discharge, slightly yellowish tinge. And she is a little bit teary from it. We did take a swab.
Okay.
Yung ano po yung mata mo?
Can you have her look at me, Dad, over here? That's good.
Yeah.
So you just look at my look at the fingers
Tingnan mo na yung
over here
mata ay yung...
and over here. Good. All right, good.
Tingnan mo yung
Is
mata
she
mo.
complaining of any pain, Dad? Anything?
Nothing. But her eyes.
It's a little bit swollen, eh?
Okay.
Okay. Okay, good.
Pain.
Yeah, a little sore. So we're going to get the eye doctors to take a look at her today, and then we thought we'd give her some medicine to make some of that pain go away. But it's going to take maybe a couple more days before we sort this out. Okay, we just want things to be safe. Okay?
Yeah. Look your eyes. Oh. Oh my God. Oh. Okay.
She had a little discharge from the eye?
Little bit. The doctor said that her eyes is yellow.
Yellow?
Yellow.
Yellow? Mm-hmm.
Yeah.
And let's just lift the upper lid a little tiny bit here, okay? It won't hurt. There we are. I'm just looking at how our pupils react. What's this letter? Can you see this letter here? No? I'm just calling about Julianne. I think she might have some obstruction of the tear duct. She's got a lot of tearing there, but what I thought was we could put her on some tobramycin eye drops if you want to, just because it's freshly post-op.
Titingnan lang, huwag kang mag-iyak.
Who's got a light? Does anybody have a light? No.
Sorry, dear.
No clear stuff coming out of the nose?
Not at the nose, no. Just around the medial canthal area.
Yeah. Okay, so I mean, what I just saw there, it looked not like clear fluid, but rather like some sort of serous and some purulent material. So I think we should just carry on with the antibiotic treatment. Good. I mean, she's going to collect, I think, tears and so on in the eye. That's what I think this is.
Yeah, she's already
So Julianne, we're going to keep you around for a couple more days.
It's better.
Is that okay with you?
Yeah. It's better.
Yeah. Oh, there she is. Hi, Julianne. Hi, Dad. All right, nice to see you again.
Yeah.
How's my sweetie pie doing? I'm just gonna sit down right next to you. Yeah, so you know, Dad, that we started the special medication for her because we thought that because the tears aren't draining well from that eye, the tear duct, which normally drains fluid from the eye, the tears, has been obstructed or is partially damaged by the procedure that we did. So that means that her tears are, instead of going down, are coming out the eye a little bit and causing some swelling of her orbit. She'll require a procedure just to allow her tears to drain normally.
Oh, this is Chris. It's okay, I'll see him over here. He's been through a lot. Yeah. That's natural. He's been through a lot. Hindi kahit ayaw mo, dadalhin ka rin eh. Huwag ka na umiyak kasi huwag ka na umiyak. Okay?
So it looks like there's a little collection of fluid just over the base of the nasal bones that were reconstructed. And I'm not sure if that tracks deeply or whether it's just a collection of blood that's liquefied and got infected. Ian, do you have any rag nose, please? And there's some dead fat here. The surgery in this area was fairly extensive, and some of that periorbital fat may not have survived and has now become necrotic, but I don't feel any tracks going down along the edge of the bone or anything like that. Yeah, thank you.
Neurosurgeons yet?
No. No, I don't think we'll need to get the neurosurgeons involved. No. You know what would help, actually? We have suction. Can you just suction down there for me?
Get the next one going, because we're doing an upper endoscopy.
Eh, si Papa ba? Amo yung kamay mo, ha? Ah, masakit? Ayaw, masakit. Ayaw, wag mo muna. Binigyan mo na ng gamot. Binigyan na siya. Ay, nag-uwi muna sandali at nagtawag kay Lula mo. Oo. Carmen, I'm going to stop by.
She's not going to cry when she sees me?
I hope not.
Yeah. Yes. Hello. Is there anybody home? There you are. Hi. How you doing? I'm just gonna look, okay? I'm not gonna poke. But I gotta have a look. How you feeling? Can we have a peek at you? Can we? Can we just pull this down? There you are. I just want to see your smile.
Oh, yeah.
There we go. That's a nice smile. Dr. Rutka was wanting to get another CAT scan to make sure there's nothing going on. And I'll be in to see her sometime tomorrow.
Yep.
But I think she shall probably stay here over the weekend, I'm afraid.
Weekends?
I think so, yeah, just to be on the safe side.
Okay. Hindi ba masakit? Ito lang dulo nito. Ito lang.
There we go. You're gonna sit up for me? That's good. Last time I didn't get to see your pretty eyes. I'll just go through here further. Are you ticklish? Are you ticklish? Huh? Are you I found the giggle spot. I found the giggle spot, didn't I? Huh? Can I go there again? Can I go there again? Okay. Right into this room. Oh, wow, this is a new room. Yeah.
no needles on there, sweetheart.
needles
No
there.
needles, none.
Yeah.
Okay, so we're just going to give you the first part of your medicine. Okay? And this will help to relax you, sweetheart.
Okay na, okay. It's okay, Kieran. Wala na. Tapos na. Oo.
Should only be about 10 minutes, okay? It's a quick scan. Going on your bed now. Okay, there you are.
Hello. Hi. How you doing? We just saw your x-rays. And they look pretty good. How's she doing?
Okay.
Yeah? Did she get some sedation for the x-ray?
Yeah. O, titingnan lang. Titingnan lang, anak ko. Tatanggalin yan.
I'm hoping if everything looks really good,
Yeah.
we can maybe send you home tomorrow.
Yeah, oo.
Do you want to get out of here?
Kung gusto mo tayong lumabas,
You want to go
tingnan mo
home
lang kay
tomorrow?
doktor. Titingnan yung sugat. Yan na.
But I need to have a look at it.
Hindi man. Ito lang tatanggalin. Ito lang, may ito lang. Sige, tatanggalin. Ano, wala na, anak. Oh, okay na, okay. Oh. Okay. No problem, yeah. No
But
problem.
tomorrow morning, I'll have a look at it first thing in the morning, and if everything looks good, we can send her home.
Okay.
And have her follow up to see me in my clinic on Friday.
Yeah.
Julianne, I'm sorry.
It's okay.
Okay, bye-bye.
Okay na. Oh, yeah. Ayos na, wala na. Oo. Tinignan lang yung one, oh. Bakit na? Yeah. Oh, wala na, hindi na nga, oh. O, di nurse na ang bahala. Oh, titingnan na. Yan. Wala na, oh.
Maganda ka na ngayon. Yun ang maganda ka na eh. Maganda ka na.
The operation was a long one. It actually went very, very well. She has a thin scar that runs down the side of her cheek here, but we were able to reconstruct things in such a way as to hide the scar in the normal junction between the cheek and nose. As she gets a little older, it might spread a little bit, but it should fade and not give her too much of a cosmetic deformity.
So, Mr. Najera, when are you going home again?
Next year, on January 18.
And mother is back home?
Her mother is in Philippines.
What did you tell her when you talked to her on the phone? What did you tell her?
I tell her about the situation of Julianne. He's now beautiful. Actually, he's crying and very happy about that. This is the best Christmas gift given to us, to my daughter Julianne. I will never forget this. God be with us always. Thank you.
Hi. How are you? Hey, look at her, eh? Oh, she's running all over the place now, isn't she? Okay, Julian, look at my fingers. Dad, you can tell her to look at my fingers going over this way and over here. and up to the sky and down. Great. No, eyes are moving great, and the appearance is absolutely excellent. So, when do you go back now to Philippines?
On 18, January 18.
It's coming up, eh?
And next week, yeah.
Okay, well, all the best to you. Thanks for coming to see me today in
Thank
clinic.
you very much, Doctor.
Okay, welcome. Bye,
Thank you very much.
How about giving me a hug? Can you give me a nice hug?
Yeah.
Bye-bye.
Okay, sweetie. Thanks for coming. All right?
Okay,
See you all later.
Bye-bye.
Okay.
Okay.
Bye-bye.
Yeah.
Bye.
Thank you very much. Pumpang. Nalagay ko dyan sa... I put it.
Wow.
Look at. Wow.
Now that Julianne's growth has been removed and she has fully recovered from surgery, she and her father can rejoin the rest of the family in the Philippines. Thanks to the generosity of the hospital's Herbie Fund for International Children and the local Filipino community, Julianne will return home to start a brand new life.
Bye. Bye.